Yeah, joining us today is a talented social entrepreneur with a great passion in mathematics, education, and healthcare. And when I say talented, I mean it. He's a man of many things, a math professor at Carnegie Mellon University, Pittsburgh, Pennsylvania, a national coach of the USA International Mathematical Olympiad team, and also a founder of XP and NOVID for today. So let's welcome Professor Po-Shen Low. Hello, Professor.
Hello, it's
Hello.
very nice to talk to all of you.
Yeah, it's so good to have you here, and thank you again for joining us today. And next, joining us also, our honorable and well-known discussant, first person, Professor Virasakdi Chongsuvivatwong, a professor of epidemiology, Prince Songkla University, Thailand. And the next discussant, Dr. Nopporn Cheanklin, an executive director of Health System Research Institute, or HSRI, Thailand. The next discussant and the last of us, Dr. Rungruang Kitpati, Chairman of the Ministry's Intelligence Unit, MIU. Thank you all for coming today. We are so grateful to have you here. So, we will begin with our first sessions here. Professor Po-Shen Low will introduce the NOVID application to us all. And after this session finished, there will be some room for us to ask some questions and discuss further on these matters. Professor Po, if you're ready, the floor is yours.
Thank you. It's a real pleasure to be able to speak with all of you. I actually enjoy working with people from Thailand. And in fact, I was in Thailand myself for the International Mathematical Olympiad in 2015. That year we were in Chiang Mai. I have also worked with several of your country's top mathematics students when we invited them to study with the US International Math Olympiad team. But that's not what I'm here to talk about today. Actually, here I am to talk about a different way of controlling pandemics, which could be useful beyond just COVID. I actually thought that we would not have to worry about COVID again quite as intensely. Well, we still do now. However, what we have made is something which was designed not only for COVID, but for much more. It's designed to help protect entire countries against future lethal diseases. Let me get started by explaining a little bit about what we do and how it is very different from every contact tracing app that has ever been made before. Now, the way that I always share my screen is that I just change my background. And so the way to see this is that I have spotlighted my video for everyone, so you can see it here big. If for some reason it is not big for you, you right-click on my picture and choose Pin Video. Okay, so a little bit about what I am bringing in on this. I am a mathematician. I also create things. And as was mentioned, I've done a few things before. But today, what I'm focusing on is the idea of naturally modifying a person's behavior. And to understand what the point is here, with all of the contact tracing apps that have been designed and put out for people in the world to use, those were designed for government to control people, to control disease. The mentality was, how do you use app to control the spread of a disease? You need to control the people who are dangerous. And that is behavior modification. But that's behavior modification where the top, the government, the leadership is trying to control to make sure the disease does not spread. We came up with a different approach. We said that if you have smartphones, well then, perhaps you can use the smartphones to make people modify their behavior themselves. How? Well, the easiest way to understand this is actually to draw a simple picture. And if you ever invite mathematicians to give talk, they might bring a chalkboard and draw a little picture. But I find it easiest to understand with a picture instead of just slides. The way you usually control disease is you find the person who is sick, and then you find out who were they around, and then the way you control the disease is you remove all of these people. That is what you usually do, and that is what all of the contact tracing apps in the world were trying to do. They were trying to figure out, after somebody is sick, they were trying to tell various people, you were around somebody who was sick. You should now remove yourself from the society so you don't get anyone else sick. Okay? Now that's a little bit difficult because the person's own selfish interests are not to remove themselves. Actually, the person's selfish interests would be to continue to earn money and go to work and go to a party. Our concept is to not do this, but instead to use some ideas from the mathematics that I work on, network theory. You see, for us, there is a bigger network. And if you have all of these people in this network, where I want to emphasize that if there are two people connected in this network, what that means is that they spend, I'm going to write very carefully, they spend lots of time nearby and often. This is very important. This is different from contact tracing apps also, because I have both nearby and often. In contact tracing apps, you find out if somebody was around somebody else, even just once for 30 minutes within 2 meters, then they are connected. In our model, we want to know which two people spend time nearby, but often, many days. And then the last thing that we do is if this person is you, we tell you the network distance between you and the sick person. And in this picture, 1, 2, 3, the network distance is 3. This is how our idea starts. Our idea starts by saying, what if you could tell people the network distance away from each new case? Let me write that down in words carefully. Each new case. Tell everyone their network distance. Okay, that is the key idea. And this can be used suddenly to go and help the person who is the app user. That's where the natural behavior modification comes in. In particular, the goal of this is that this is suddenly a new kind of information that was simply not available to anyone ever before. You see, when you were trying to avoid getting sick, what did you do? And actually, that's a very important point. In this pandemic, people wanted to avoid getting sick themselves, but they didn't necessarily want to avoid getting other people sick. Those are different things. And if you want to avoid getting sick yourself, there were not great tools to do that before. Except that now that we have this new concept, you could show people how far away the disease is striking in a way that can help them avoid getting sick. The way to read this picture is that on June 3rd, degree of connection tells you how far away the sickness had struck and how many people had been struck. Right now, it's very far away. This is first, second, third, fourth. Each of these is one more step in this network. In this network, 1, 2, 3. This is 3. Okay? But the beauty of this is that you can have this move over time. So what you see is that as every day is changing, the situation may change. And then a person can see that this Omicron or this new Delta variant, this is striking closer and closer and closer to them. Now, I want to emphasize, this is each new case tell everyone network distance. There is no privacy issue of you finding out that this person you have lunch with is sick. That is not updated by the app. The app will not tell you the person that you're having lunch with is sick. The way this app works is as soon as there is a new notification of a sickness, at that time that the notification happens, all the distances are calculated and told to you once. And what this picture means is that more and more people are getting sick, and those people who are getting sick are more and more relevant to you. Why is this useful? Well, that is why it has a natural behavior modification. Because you see, suppose you found out that there is some sickness coming closer and closer to you. Maybe it looks like this. I'm showing two different dates. Maybe this one is the before, and this one is the after. We actually made this over a year ago. And so you see this January 28th, that was actually simulating last year's. But in any case, think of this as the past and think of this as the present. And if a person saw this, they might actually want to take caution. Actually, the way that this works is it is using the smartphone to help the person who has the smartphone, which is how every successful smartphone app has ever worked. If you want a smartphone app to work, it has to help the smartphone user. But what this is showing is there is a way to help the smartphone user. You can tell the smartphone user that this new disease is striking people who are closer and closer to them, where the notion of closeness is not kilometers. That's very important. Kilometers are not that useful. The notion of closeness is in terms of spending lots of time nearby often. And I saw that we have epidemiology research specialists who are here in this audience. The concept that we have is with smartphones, we can do something epidemiologically interesting. Here, each of these links is supposed to correspond to something like two people who live together or two people who work near each other in the same office. Those are ways that disease can transmit easily, especially at home, because you might not be wearing the mask at home. So what we are telling people is somebody just got sick. They very often are very near somebody. That means that this person probably got sick already. And that person is very often near somebody else. That means this person is probably going to get sick soon. And that person is very often near you. That means that if you don't change your behavior right now, you will probably get sick. And the idea of this is with that information, well then maybe you might want to change your behavior, because this can help you not get sick. This is very different from the contact tracing apps. The entire world's contact tracing apps were designed to make sure that the people who are dangerous, these people here, don't infect anybody else. That's what we've been doing for hundreds of years, to try to make sure that those people don't infect anybody else. But what you can do now that we have smartphones is you can make a way for people to avoid getting infected themselves. Okay, let me go a little bit deeper into the theory here. The theory is actually quite simple. It's quite common sense once you see it in this way. And it's useful right now to put a very clear contrast between this and every contact tracing app that was ever made. The contact tracing apps were in the past only telling you about about you and whether or not somebody got sick who had already spent time with you. That would be equivalent to blocking all of this information and blocking all of this information as well. The principle was just to tell the people when they had already been around somebody else who was sick. And our idea was, if you expose additional information, then suddenly the tool becomes useful to you as the app user, not only useful to the society. And that's a very big difference. Actually, the pioneering people who made these apps were in Singapore. That was traced together. And then many countries came afterwards, all following the same model of showing distance 1. And Distance 1 has the problem that it doesn't let you take self-defense measures that you might want to take at distance 3. What do I mean? Well, suppose that I actually don't want to get sick. And here's where I need to be careful. The current phase of COVID, it's unclear how lethal it is. And I have noticed, everyone has noticed, that people's attitudes towards the disease are related to its lethality. And in particular, COVID might not, maybe right now, it might not be at a level that makes people themselves want to worry extremely much. However, it could be that a future variant of COVID could come along that might suddenly have a lethality rate that will make people not want to get sick. Our app is the one that was designed to help people who don't want to get sick so they can stay healthy. That's the principle. But if people don't care about getting sick, that's a separate problem. By the way, for all of the contact tracing apps in the world, they actually have trouble, those other apps have trouble protecting you if you don't want to get sick. So this is already an advance. We have the first app that can actually help you not get sick. The contact tracing app doesn't help you with that. But what would you do? Suppose that you wanted to not get sick. Well, when you saw this disease getting close, then you might want to wear a better mask. There are different kinds of masks in the world. Some work better than others. Today, I am wearing a more careful mask because the Omicron is so easily spread. But this is showing because I don't want to get sick, so I'm taking some action. Or you might want to increase distancing. I'm actually doing this also because of this Omicron variant. I don't want to get sick, so I am trying not to eat in a restaurant. But I'm just saying that these are things that I would want to do if I could use it to help myself not get sick. And the beauty is if you can show people a way to know when it might be a good time to be careful, if they don't want to get sick, then they can use it. And here comes the first big difference between this and all of these contact tracing apps in terms of the potential power. This is related to behavioral science. There is a concept called a Nash Equilibrium. That's a fancy word for just saying that a Nash Equilibrium is where people are doing some behaviors and nobody has any incentive to change their own individual behavior. That's called a Nash Equilibrium. And the problem with that in behavioral science is that sometimes, even though everyone is better if everyone moves and changes, unfortunately, if there's a Nash equilibrium, it's difficult to move to that better behavior for everyone because nobody wants to move on their own. And that, to me, was one of the big limiting factors in pandemic control. It was very hard to get everyone to do the same thing because individually, it was not a great decision for them. What do I mean? Let's compare the two kinds of apps. If you install this kind of app, you can use it to reduce your chance of getting infected yourself. When you see the disease coming closer, you protect yourself better. It can even help you not get quarantined. If you see things coming closer, you stay home. And the interesting thing is that's your own option. It's not that you have been quarantined and now you're being observed. The second thing is that if you compare to everything else, actually all of those other apps that are designed to control the disease in other countries, I don't know all the details about Morchana, which is what you guys have, but in many of the other countries like Singapore, United States, China, Korea, South Korea, all of those contact tracing apps, those are designed to tell the user, you are now the dangerous person. You should stay home, don't get anyone else sick. That reduces everyone else's chance of infection. But if you think carefully, how does that app help you? It's unclear. And at this point, I want to say a comment. I did a bit of research on Morchana. It sounded to me like Morchana would maybe tell you things about whether you had been in a location where there had been somebody else with COVID. And what I understand is that if you're using GPS for that, there are concerns some people have about privacy. And those are real concerns, that if you have GPS information, then you know a person's track, and that's privacy invasive. But there are other issues, which are that the GPS level of accuracy of whether or not even having been in that same location, approximate location, imagine a multi-story building, just having been in that approximate location, Does that mean that you are likely to have gotten sick? It's hard to tell. And that's why actually Google and Apple were involved in building something using Bluetooth. My understanding is that Morchana does not use the Google and Apple Bluetooth system. And by the way, I can say much more about that in the second segment, when we're going to talk about using this to try to epidemiologically study what's going on with the disease and even track its effect on vaccines. But ultimately, with this trade-off, the trade-off was that even with all of the apps that are anywhere else in the world, they are not super effective in helping me not get sick, because when it gives me information, it's unclear to me what risk that is even telling me. But what we did with the app is we tell you, somebody just got sick. They very often are around someone else, and that person is very often around you. That's called two. Actually, this is a real warning, because if there's somebody who got sick and they are often around someone who's often around you, then you actually probably should be careful. It's something that you really want to take action on. Okay. Let me talk a little bit about some major benefits that this can bring. Because if these were just small gains, I would not be going around the world talking about this concept. But the reason this concept has been in the Straits Times, national newspaper of Singapore, and why it has been in various conferences, research conferences, is because it has several major advantages over status quo, order of magnitude. Now, this word anonymous, my understanding is that most contact tracing apps in the world are anonymous, where they promise that you will not be known. I saw that in the Morchana, you're supposed to take a selfie, but supposedly that's not shared. That's what they tell you. And so I'm going to assume that the Thai app is also anonymous. But then there's a big problem. Well, actually, this number is no longer accurate. This 10% is no longer accurate, because now that we have the Omicron, these slides are always being adjusted. With the Omicron, we don't know what this is, right? This thing could be quite a bit higher. However, the bottom line is, even if it's higher, anonymity and quarantine are not compatible, because they're asking you to do something that you don't want to do by yourself. And the clearest example of this we see in the United States, where there are people who are told by their app, you should stay home. And unfortunately, they just say, well, the app promises that nobody else will know that I was told to stay home, so I won't stay home. And what we did is, by flipping the incentive to protecting yourself, now suddenly, if you want to protect yourself, you will. So this is an app designed to help people who want to save themselves. Second one, I don't know how Morchana gets the positive status because it's supposed to be anonymous. Most of these apps which are anonymous are designed so that you press a button or you have to report yourself. But unfortunately, that doesn't always happen. So especially in countries like United States. And so since this was designed in the United States, we added a second level. Actually, I can talk more about this later, but we actually have something where on our app, we have two buttons. One says that I am sick. The other says I was around someone who was sick. By adding that second button, we are actually able to get more signals. Because even if a sick person doesn't press the button themselves, somebody who was around them can press the button saying, I was around someone who was sick. And then in this concept here, it's still useful. Because suppose what you found out is that, not that that person was sick, but suppose you found out that that person was around someone who was sick. If you found out that this person, meaning somebody who is distance 2 from you, was around somebody who was sick, then there's a sickness within distance 3 of you. It's still useful information from the point of view of trying to protect yourself. And then in that case, that's actually why that's why I've been pushing on this idea, because again, this is bigger than COVID. This is actually a tool that can be used to protect an entire country from a future lethal disease. How? Because if there's a future lethal disease that you don't want to get, then if you're able to find out as people who are sick or people who are around people who are sick, as they're reporting, as you see this disease coming closer and closer to you, then you'll actually want to take caution. And this is a totally new way of being able to protect people from getting sick. It's a new way of separating these two groups. Because what happens is that in the past, you only try to control this group and ask them to do something that they don't necessarily want to do. And what we've done is we say, let the people here know how far away this is. And as it's getting closer and closer to them, they'll actually want to be more careful if it's a disease that's lethal. And that's why I'm so happy to be able to talk to all of you, because this kind of framework, if we can teach everybody how to use, all the people in the country, all the people in the world, if we can teach them how to use this kind of framework, we can help defend free societies in the world from spreading lethal diseases in the future in a totally new way. By the way, this can be used together with all kinds of other ways. You can also still do contact tracing. You can also still develop vaccines. You can also still wear masks. It just adds a new layer that can be used called radar. Radar. Just let people be able to see how far away something is. And then they might want to be careful and not get sick. One more thing, many people are often wondering, how does this work if you have asymptomatic or untested positive cases? And the answer is, it's still useful. Actually, it's more useful because of the long range. If you are trying to defend yourself, you just want to make sure that the red doesn't get to you. Now, if you can't see all of the cases, it's okay as long as you see that there are some cases, some fraction of the cases being detected, because then you'll see the wave coming towards you. In fact, with a disease like Omicron, with a variant like Omicron, if people had this app, everyone would see this cloud coming very fast towards them from far away. Actually, who knows? Maybe they'd even be careful. You see, the issue is that a lot of time, people only become careful when they already see someone around them who got hit. But that's too late. If the typical person already knows someone around them who got hit, that is too late. Many of the people in the country or the city have already got hit. Our concept is to let people see before it gets close to them, just like a radar in military. Once radar was invented, everyone wanted radar, because if you can see the danger coming before it gets to you, of course it's useful. That's actually what this is. Okay, I want to say a few comments about privacy. Because our app is designed to help you, the user, we really don't need to know anything about you, because we don't need to make sure that you do something that's good for everyone, but not good for you. I have no enforcement. I have no enforcement needed. And so we have completely random user identifiers, no phone number, no email address, no name, no selfie, no IP address, nothing. Just make a random number. And then no GPS either, because GPS is dangerous. If you have a person's GPS at 3 a.m., that will say a lot about who they are. But the way our system works is that just when the two phones are nearby, they talk with Bluetooth and they detect that they were nearby. And we remember in the cloud that these two random user IDs were near each other at this specific time. And that's it. So that's actually how we build our entire network, only with Bluetooth of who was around who else. And let me finish with this a little bit in this first half hour, where people are sometimes curious, how does this work in the real world? It's hard to know, because I have not had the chance to really have these conversations with very, very high level to go and put something like this out at large scale into the real world, mainly because actually usually when there's a new approach, people want to try everything else first, all the other methods first. Unfortunately, we're now seeing that all the other methods are not working. But there were a few universities that were interested, and we had some very small versions of this, old versions of this used to see what would happen. And something that we found out is that, for example, at Georgia Tech, which is a university in the United States, this thing validated one of the assumptions that we had. One of the assumptions we had was that this tool would be able to connect together a lot of people, a huge fraction of the community, with only a small amount of adoption. And it happened. Only with very small level of adoption, once it passed that small level of adoption, then people were all connected together into a large network. This is small words, but what this is showing is this is not showing how many sick people. This is showing how many people are at various distances from you. And I can talk more about this during the Q&A, but what we found out when we deployed it at these universities is that after only a very low amount of adoption, a lot of the people were connected together, as was predicted by the network theory. That's my area of mathematics. We knew that would happen. As soon as each person had 2 or 3 other connections, then they were connected into this network. We don't have any conclusive evidence on what this does with behavior change, only because at these places, it was not officially pushed, officially endorsed by the universities as something that people should really use, because this was a new technology at the time. And so people they did not fully understand this, and they were not pushing this to tell everyone, let's all use this. However, at this point, we are now able to see that a lot of the other technologies are not sufficient. And also this idea, this new concept, and this app have been around and have circulated around in the research world. So hopefully we are approaching a time when people are interested in trying a new approach, which should not have any harm over the old approach, should not have any problems, but can give more power. And so what we are looking to do now is to start having this used in some other focused areas so that we can find more information about how well this works in changing people's behaviors. But with that, I think we have gotten to the end of the first half hour. So I think it might be a good idea to switch and have an interactive discussion. I will have more things I can say in 15 minutes towards the end.
Okay, thank you very much, Professor Paul. Such a beautiful presentation you just delivered here. It has brought me back some memories when I was doing my degree at college, because the style of your presentation is so unique and very nicely done indeed. So, being mindful of the time, I will first ask our discussants to provide their initial reflection and thoughts. And I know that Dr. Rizal might not be able to stay with us that long, so I will call upon him to provide his reflections on the first session's introduction to NOVID. Professor Virasakdi, the floor is yours.
Thank you, Professor Law. I have written my discussions in the chat. I have 5 points. I starting with just like you eat the pineapple, you eat the sour part first and eat the sweeter part later. Okay, if you don't mind. I think most of the apps. When I look at the news, I'm very enthusiastic in Korea, in Singapore, in Thailand, but I think most died out. Maybe, as you say, because people that's against people nationalities, or maybe is overwhelmed by the quick spread of Delta virus. You can do contact tracing when you have enough people to see, to follow the information and take actions, right? But your app is different because your app is based on people nationalities and react. You don't need the government to do much, right? People will try to avoid the when they say they are threatened, then they just insist themselves, right? Encapsulated themselves against any incoming virus. Maybe they will consider themselves as self-quarantine, self-isolation, whatever, just to protect against the incoming. But the assumption is that the apps know the person faster than the virus spread, which is, I doubt whether this is true, because when you get a lot of asymptomatics, you have no way to detect this one. Whatever apps has to depend on the information fed into the computers. When you don't have any system to detect the asymptomatics, I doubt whether this one can detect the persons against approaching to asymptomatic persons. It's I think that's the difference when we have the first wave of COVID. We don't know yet, like SARS. We don't have much asymptomatic, not many asymptomatic SARS. So the disease containment is easy, but I guess that Omicron has a lot of asymptomatic. That's why double time is quick because of a lot of unknown contact. Well, that's the first comment. Sour part of the pineapple. The second one is.
Oh, good.
The second one is NOVID. We work in rational and self-disciplined populations. So I think people must believe the theories of exposure will get you sick. Sometimes I don't believe. I think exposure will give you the immunities if you expose to optimal levels, because this is dose-response relationship between the inoculums and your risk. Once you get the minimized inoculum, like Edward Jenner, when he discovered the first vaccines using the cowpox and using some scraps from the smallpox and put into the nasal cavities of the person, and that one get very mild disease because of the inoculum sites. So myself, every now and then I will go into the small crowd in the canteens when the patient, I know that a lot of patients don't wear the mask and they talk, and there's a lot, but I wear my mask. I hope this is not very strong protective mask, because it's just a simple surgical mask, and to get some minute amount of daily. That's my assumption. The rationale depend on people, what people think. I don't think people think like me. Maybe I'm very exceptional, so don't worry about that. The third one is, I think this is very important. Your network analysis depend on, you will get very good network data if you don't have missing link, and this is a problem. The missing link can come from people who don't have mobile phone, or don't. In Thailand, a lot of people don't pay for internet. They just pay for mobile phone and and Bluetooth, etc. So if they don't turn on your apps, and then they don't turn for the Bluetooth for any reasons, then you have a missing link. The distance, a lot of people will, in a network we call singleton, right? Singleton means you don't have any connection with anybody because nobody has Bluetooth allow you. So in that case, there would be a lot of singletons initially, but we hope that when the Bluetooth is cheap, Bluetooth is already cheap, and the network. I think you have to have Bluetooth as well as the network, right? Or you just have the Bluetooth. You have to have the locate.
No, we only need the Bluetooth. We do not need to have the network.
Even the what you call the flight mode, but turn on the Bluetooth is okay, right?
That's okay.
Yes, okay. I think this is smart things, but still people have to install your apps and have to turn on the Bluetooth, and that may not be a great problem. I think NOVID analyze the past. You cannot analyze the future. Who are you going to meet in the next meeting, in the next shopping centers? That people are moving, so you don't see your future. NOVID only know your past status. NOVID don't know your future status, whether who is going to expose. So that's a limitation for mobile people. And I think the last one is a sweet part. I think NOVID is very good to opportunity to study behavior user on the apps. I think we have a lot of apps. I think most of the contact tracing failure is, I said, first due to the missing information and the overwhelming personnel to do contact tracing. But a lot of failure is due to people compliance to what they think. So you got rationalities as a theory. I think that's good. We have an app for the people. We have, I think in United States or Singapore, you don't have much tuberculosis, but we have a lot of tuberculosis that people don't take medication because of a lot of side effect, and it's the whole grabs of medicine every day and a lot of side effects. So we conventionally we use face-to-face direct observe therapies, but in COVID that is not possible, and by rationality people eventually give up dots because it's too cumbersome. They eventually exhaust and let the patient die, and the patient agree to become drug resistant. So we use these video observe therapies, and we observe the user. The patient is quite steady within the intensive period, but the observer fade down very quickly because they don't have, as you said, they don't have the motivation or the direct benefit to look at the apps compared to other interests. I think your study would be good to see whether the rationalities and the discipline can keep on in the patient. I would agree to support your study in Thailand in any place, because it's a good idea to see how people react to the new world. Thank you very much. Good luck, Professor Ro. Nice to see you.
Thank you very much, Professor Virasakdi. Such good comments and reflection made here, very constructive. Professor Paul, before we move to the second discussion, would you like to provide some clarity or address some points that made?
Oh yeah, absolutely. So first of all, thank you very much for sharing all of the ideas and the concerns that you had. I actually prefer conversations where people just say, here are the concerns, because it turns out that oftentimes those concerns are addressable. It's just that the way that we are doing things with this app are so different from every other app that although those concerns apply to all the other apps in the world, they actually can be solved by this new approach. And so I wanted to actually talk about this. I think this is very, very useful. So the first one is where you mentioned about the asymptomatics. Actually, that asymptomatic issue, that's one of the fundamental flaws of all of the other apps out there. But ours actually overcomes it. And it's important to discuss exactly what that means. So why is ours able to suddenly be able to handle asymptomatics in a way where normal contact tracing and contact tracing apps were not sufficient? It's because we have longer range. The best analogy is like this. Imagine that you are fighting against stealth bombers who are coming towards you. Now, when I say stealth bombers, I think I just mean that they're actually, no, stealth bombers is the wrong word. No, I should actually just say just aircraft. Think about World War II. You're defending against aircraft. The way that everybody else defended against aircraft before is you wait until you can see the aircraft and you hope that you saw the aircraft. And if you weren't looking right, you miss the aircraft and you get bombed. Then radar was invented. Radar has longer range. If you're watching the radar and you're only catching 20% of the radar, or if you're only looking 20% of the time, you will have more chances to observe something is coming towards you. And actually, that's why I put this picture here. Because the way this works is that, let's think about it from point of view of you trying to not get sick. Well, if the disease is spreading towards you, Omicron or whatever the variant was first arrived And when it first arrived, it was very far away from you. That's where it's very important to note what this network is about. This network is about the frequent interactions that you have. And so when this new variant strikes, it actually starts far away from you. And now, in order for it to become dangerous for you, it needs to strike more and more and more people. That creates a bigger lump of people for whom they are sick, and some fraction of them show up. And that's actually why on our charts, we try to make it so that the chart doesn't show the true number of people who are infected, but we cap it. We cap it because people are not good at understanding exponential growth. And so what we're showing people is that there is some number of people who have gotten sick, and that cloud is striking and moving closer and closer to them. It is not perfect, of course. Maybe there will be some case which leaks, and asymptomatically, even though this person was sick, then the next one who got sick not detected, then the next one after that, only that person detected. And you see that the blob jumps towards you. But the exciting thing is that by the law of large numbers, this is statistics now, if what you're watching is you're watching the blob move towards you, if a fraction of the blob is what you detect, even if you only detect a fraction of the blob and not the whole blob, you still see that there's a blob coming towards you. It will just be less accurate around here. When it's really, really close, you're not able to tell as much because you don't have the law of large numbers. But the analogy is that with all of the normal contact tracing and the normal contact tracing apps, why those could not handle the asymptomatics is they waited until it was right next to you. At which point, if you didn't catch it, too bad, you got hit. So what I'm trying to say is that I agree with you that the asymptomatics are a major issue. And in fact, what I claim is that if we want to have any method of controlling against asymptomatics, we must increase the range. And so what I'm saying is that actually you raised a fundamental problem. If you cannot see the disease,
how soon should you react?
Sorry?
How soon should you react? Because the disease may come before the signals. Okay, so you said in your phase this is number 3, right? But the disease may the germs will come before what we call the bulb or something. Okay, so
yes.
So in that case, we have to think how you have a lot of noise in your radars.
Yes.
Okay, that's you should have the ROC curve. Whether you have to buy the noise or not buying the noise, because when you react to the noise, you may fool by the noise, and when you don't react, you may get hit by the signals.
I agree, and that is just like radar in the year 1942. In 1942, radar was not perfect, and so the point is that what we have put here is actually, this is very exciting. We can now put radar for pandemics from a personal point of view, and it will be noisy, just like radar in 1942. But 1942 radar changed the entire war in Europe, for example, because even though it's fuzzy, and that's why I add one more thing. This is most useful, it's related to your second point about rational, right? Actually, what I want to add on that point is I want to say the way that this is useful is it's useful for any disease which is sufficiently lethal. And I'm not sure that COVID is sufficiently lethal yet to cause people to really want to take caution. However, the reason I'm sharing this idea worldwide is because we know that there are diseases that can be far more lethal. And actually, once you have a disease for which it has a lethality rate of 30%, like MERS, or even worse, if there was a high lethality rate disease, suddenly you will see people who will want to be more careful with this fuzzy radar, the same way as World War II. If you were in the middle of the Pacific Ocean and you see some cloud coming towards you, even if it might be birds, you're going to launch a fighter plane to go look. Do you know what I mean? But what I'm trying to say is if it was not World War II, you're not going to launch a fighter plane because it's not dangerous. But what I'm trying to say about this is why I love that I can talk to you is because this is the beginning of research. I'm trying to say that against COVID, I claim right away, against COVID, I don't know how effective this is. However, against future lethal disease, if we work together and we, during COVID, experiment in some small scale to prove what this can do, we could save the entire country against future lethal disease, because then all the people will be saying, okay, maybe it's noisy because of asymptomatics, but I don't want to die. So I'll be better safe than sorry.
But the effective disease would have a lot of asymptomatics. The disease that can spread can have a very good doubling time, would have a lot of asymptomatics, and it can become pandemic. If it has a lot of lethal disease, I mean, high fatality like MERS, it will be contained very quickly.
Well, I'm not entirely sure. Actually, why I brought that up is because we have in the past only seen diseases that were lethal and not contagious. But I think that's survivor bias, because if there was a disease that was both lethal and highly contagious, we might not be here to talk about it. So to me, it's unclear to me.
HIV is one of them.
Yes.
Very contagious and but the very long incubation period. Yeah,
that's right.
That's the limitation, because before you can get the signals, so it's very
long. Right. That's right.
Okay.
And so what I'd say is that for us against HIV, that delay not effective.
Yes.
But fortunately, what I'm trying to say is that there's a certain spectrum of diseases which is lethal, contagious, and not 1 year incubation, but like shorter days incubation, on which this kind of a tool, even though you have asymptomatic, you would still be able to see that there's a blob, a noisy blob moving towards you.
Okay.
So I wanted to say that for the point one, which is that the fundamental thing is, you're right, asymptomatic is bad thing. It's bad for everything, not just this. And this is, in our opinion, one way that you can still get value, even if asymptomatic. There are a few other things I want to say quickly that respond to a few other things, just to explain, what this is saying. Rational and self-disciplined population, I will say, for COVID, yes, but for lethal disease, suddenly you have more power. And that's related to the third point, which is whether or not people are installing it and having it on the phone. There's one important detail. This app works even if you have no mobile data connection. This app only uses the Bluetooth. And if you don't have Bluetooth, the way this app works is that it also checks if two people are connected to the same Wi-Fi access point for several hours. Because remember what I'm trying to do. I just want to know who is together frequently and often. I'm not trying to catch the bus I'm not trying to catch the interactions on the bus. That's not super important for me. I want the frequent connections, and the Wi-Fi will catch that. So that's related to your question about will there be lots of isolated points? Actually, from what we have seen, no. Because of the fact that people live with other people, automatically linked. People work in an office near someone else. In some parts of the world, they are so rich, they never connect to the office Wi-Fi. That's fine, then their Bluetooth is on. Other parts of the world, they are not rich enough, and they connect to office Wi-Fi. Bang, now we got it because of the office Wi-Fi. So the two cover each other. And so what we found out is that we can capture. Again, not perfect. I will not say perfect. Nothing is perfect. It is only that I'm showing you a few things that we do that people don't know because this is different. And then there was this other thing about the past and the future. I want to touch that one because that's very important. Actually, the way we say it is that this tool uses the past to predict potential future interactions. Not all future interactions. You're right. Who might you see at the shopping mall? We have no idea. You might get sick from that. However, what this is trying to do is it's trying to make it so that even though you have some infections coming from the random, this will at least help people see the infections spreading on the highway. When I say highway, I mean at home, no masks, or in the office, same airspace, hours and hours. That is one highway along which things can spread. And so that's actually why the way we build our network is who is around each other often, because that's who you will probably be around again in the future. So actually what we usually explain with this app is we tell you a sentence that is related to your future interactions based on what we saw from the past. We tell you, somebody just got sick. They are very often around somebody who's very often around you. And that means that in the future, you might be around the sickness. So you might want to change your behavior to protect yourself in the future. It will not protect you against the shopping mall. It will not. Nothing can protect you perfectly. But this can at least protect you against something coming along that highway of co-workers, co-living. And if you see it coming that way, you can do something before it's too late.
Okay.
So I just wanted to add those.
Thank you very much, Professor Po, and also Professor Virasakdi. Very rich conversation and discussion, and I hate to break it down for now, but we will move on to the second discussion, Dr. Rungruang, to provide his also reflection on top of what we have discussed before. Dr. Rungruang, the floor is yours.
I'm Rungruang from Ministry of Public Health. Professor Po-Shen, I would like to thank for your excellent sharing. I think NOVID is an application with high potential, one of high potential. And I review NOVID application before this webinar. I think it's it's easy to use and friendly to use. I think it the possibility to be applied in Thailand, especially in the specific area or small small province in Thailand. In Thailand, COVID situation changed in Thai consumer behavior from our statistic. Smartphone usage among user age 16 to 64 years in Thailand found that average use more than 5 hours per day. And now the usage is in the third most in the world. From our National Statistical Office data, there are many as 46 million of or 70% of Thai people who use smartphone now. In today, the webinar meeting, I'm a representative of Ministry of Public Health. I am pleased to collaborate with your executive representative of NOVID in implementing in Thailand. I think COVID-19 information is available in variety database, such as for the contact, infected person, vaccinated person. The information is in a variety of database in various departments. I think for concern about the false security because Thai different from US or the other country. Maybe we include not only from individual but also in the multiple database include this. NOVID implementation in large scale in Thailand in level national level. I think chance of success are less than in small scale or specific area, such as the Phuket East and Eastern Province tourist area with foreigner and develop into smart city. I visit for Phuket is suitable for NOVID. For the language should be in Thai, English, and cover most of tourists, immigrant, foreign worker from different countries. I am willing to coordinate with the various agencies for implement this. Thank you very much.
Thank you, Dr. Rungruang. You have covered additional points from Dr. Virasakdi and clarify a bit more. So I'll ask Professor Po if you'd like to address very quickly, and then you could start your second sessions on potential use of NOVID on additional disease. Yes, Professor Po.
Yeah. I actually first want to say I am very happy to hear what you have said. I am the kind of person who wants to work with you. I am not the kind of person who wants to say, you must do it my way. Actually, the way I see it is that you understand your country and your people better than I will ever understand them. I only want to bring you this framework that can be adapted to suit the truth of what is happening where you are. And I think the best way to do that is to collaborate with Thai scientists and Thai government, because I don't want to just say, use it, trust me. I want to work with people who ask hard questions, and then we work together to find the right answers to solve them. And I just think that because of these problems about asymptomatic, because of the way the world has more diseases in the future, we must have scientific approach. And I would love to work together with government and with your other researchers. My hope for this webinar was to build that connection. I myself am actually not businessman. I'm a math professor. I'm a researcher. And this is just the beginning, in my opinion, of what could become much bigger.
Thank you very much, and nice to meet you.
Yeah, thank you both. Professor Po, would you like to go on to the second sessions on potential additional applications of NOVID?
Yes, so I can talk about this.
Yes, and then
I can talk about this.
We
yes?
would address the Q&A at the later sessions before we close the webinar. Yeah. So
okay, very good, very good. I'm just putting myself on the spotlight again.
It seems like we have lots of questions on the chat box here. So yeah.
Oh my goodness. Yeah, I'm sorry. My vision is quite bad, so I have difficulty reading those comments clearly. But let me just go on and say the other reason why we are so interested in this concept is because I feel that we have been flying blind with data during this pandemic. You see, we should be able, with the smartphone, to know much more about the spread of disease. For example, I have a friend of mine who works for Google Maps. And so I was meeting with him and we were just talking. And at some point I said, you know, you guys who have Google Maps, I bet that you have all the data required to know who was around who. Why are we even bothering making these contact tracing apps? For example, where I live, the Google Maps tells me what the traffic is like. How does it know what the traffic is like? It's not using pictures from airplanes or satellites. No, it's using the smartphones talking to nearby smartphones and using their GPS and figuring out what is happening on this highway, which has 1,000 people moving on it. They have all the data. And I told him, why don't we just share that? And he just smiled and he said, well, but that's the business value here at Google. We can't share that. That's our secrets. Those are why the business is valuable. So instead they use it to sell advertisements. So what I'm trying to say is that we are living in a world where there is enough data on smartphones to be able to do all of this analysis that we would like to do. The only problem is that it is in the hands of companies who have no interest in doing that. And they also don't want us to know how much they know about us. That's why once we made an app where you can explain to a normal person, here's why you want the app. Here's why you want the app. Not here's why you should use the app to be a good person. No, here's why you want the app. It can help you not get sick. Oh, that's the same reason I use Google Maps. Why do I want to use it? So I can find my way through traffic. It's something for me. The main point that we had was, if you want people to use an app, put things in the app that help them directly. Then they can give Google all the information to do all the things Google does. And they can give us the information, us meaning not just me, but us. If we work together, Thailand, us, we can get the information to actually understand what's going on in this pandemic. Because you see, once you have a network, you could try to figure out what's going on with these different variants and these different vaccines. So I put a word only here. There's a reason why I put this word only. Earlier, I said a comment about how Google and Apple had made some kind of a system that they tried to convince other countries to use. I was doing some research and I seemed to not be able to find a Google Apple app that Thailand is using nationally. So my guess is that you are not using Google and Apple's exposure notifications. That's okay. You're not missing anything, because a lot of the other countries that tried using it, it's unclear that it's doing anything. But you see, there's some history here. Google and Apple control the smartphones, and they made it so that it would be very difficult for people to write smartphone apps that let the phones talk to nearby phones when the apps are not on the screen. That's why in Singapore, at the beginning, their Trace Together app, they told everyone, if you have an iPhone, make sure that you put the app on the screen all the time, not the lock screen. The app had to be on the screen. And the United Kingdom spent £10 million trying to make an app so that the app would still work even when it was not on the screen. They failed. £10 million lost. And everyone thought it was not possible because people had tried. And eventually, one country after another just started using the system made by Google and Apple, because that was the only way people thought you could have phones talking to each other with Bluetooth when the apps were not on the screen. Well, we actually figured out how to do that. So we figured out how to build a system so that even when the app is not on the screen on my iPhone can still talk to nearby apps and find out whether we are around. And so we actually have the only infrastructure designed in the world right now, which is battery efficient, doesn't require the phone to have the app on the screen. And even if it's iPhone, the iPhones can find out that other iPhones were nearby when the apps are not in the screen. Okay, suddenly all you need is that people install the app. You don't need that they do anything with the app. It doesn't need to go back onto the screen. It just works in the background. And then the value of this is that we actually have this real-time data about user ID X and user ID Y who were nearby each other. Okay, we collect this information. We also have something where people can mark down which vaccines they got and what dates. There are ways to even validate these. If you make some codes, if we were working with you and you make it so that when someone is vaccinated, you also give them some code, then you can make sure that when they enter it in the app, it is using a code. But the important thing is that now we have this information that there are people, actually there are phones, and these phones are around each other. Around those phones, we have a big network, this network. And then what we also know is when someone is sick, we are able to know who else got sick in the network. This suddenly becomes interesting, because if you could have the network information and also know who was sick and who else sick and what vaccine they got and when they got the vaccine. Oh, and if you can label the sickness with Delta or Omicron or whatever it is, then you could use the network data to start to analyze which vaccines are more effective. You don't have to wait until Sinovac tells you what is their efficacy. You could just know that there's a sick person and around them were 4 people. And maybe all 4 of those 4 people had used vaccine X. And then you'll find out what fraction of those people got sick. You will get real-time information about who is getting sick from which variant with which vaccination pattern. And that would suddenly be quite powerful in how you try to control policies. Because right now, we just don't know anything. We have to wait until Moderna or Pfizer tell us, or some scientists study Moderna. We have to wait for that. And furthermore, did they study it in Phuket? Did they study it in Bangkok? It could be different in different parts of the world. But our system is actually what the UK and Germany were trying to get. There's a reason the UK spent £10 million trying to build this, trying to build an app for which even when the app was not on screen, it could talk. It's because the UK has lots of scientists, and the scientists wanted to be able to study in real time how the disease is transmitting, just like how Google studies in real time so that they can detect the traffic and then sell you advertisements. All of this stuff can be done, but it should be done. It's just that Apple and Google had the control, and these technology companies did not want anyone else to be able to go in. We figured out how to do that. There's something else you can do with this on vaccines too. See, there's also this importance of trying to have people overcome vaccine hesitancy. One thing that this could also do is it can let a person know that many people around them are getting vaccinated. This is actually the display of vaccinations in our app, where if you marked you got vaccinated, it will tell you, it will tell everyone there are vaccines and the vaccines are happening. If a person sees that more and more people are getting vaccinated, they can feel more safe that, you know, maybe there are no serious side effects. Maybe the only side effects you hear about are the few that happened and got blown up into big news stories. But maybe, given how many people are getting vaccinated, maybe it's reasonable, and maybe I will also get vaccinated, especially if I compare the vaccine chart together with the chart of all these infections coming nearby. I might decide, I see a big wave coming, maybe I want to get vaccinated. Basically, the bottom line of this is, it's not perfect. Nothing is perfect. However, it's a new paradigm. We have no good way today of controlling many of these problems that we have. And therefore, we need to be using longer range. And this concept is just, let's give people range. Let's let people know things from farther away. It's more information. But if you have the more information, and we study together with your researchers and with your government to figure out the most understandable way to tell people this information, then we could potentially have ways that we ourselves can be understanding more about the epidemiological aspects of a disease. And we might even be able to help convince people to get vaccinated at times when it's getting more dangerous for them, when they still have time to get vaccinated, instead of waiting until it's too late. Now, I saw there were a lot of questions, so I cut this part shorter. But my hope is just to work together and put this new foundation of radar into reality. And if we do that, we'll be even more protected against the future. Thank you.
Thank you very much, Professor Po. Yeah, this potential application of NOVID is so good and interesting in terms of measuring interactions between vaccine and also the variants. This would further the research field in our world in terms of real world effectiveness of the vaccine itself. That's very good. And also on the point of creating a safe space that showing how many people get vaccinated around you, I believe that there's a lot of apps and also channels where they are trying to do that in like our country, including around the world. For example, food delivering, they also show that like these riders got vaccinated already. So it's giving a peace of mind for people as well, and that is a good thing about. So we will start addressing some questions from the chat box. I think there could be a lot, but I will pick some key questions, and other than that, I might email you to perhaps you could address later on, and then we will share the answer with the audience later on. So the first question, if they are under reporting of cases, will the app give false sense of security? That's the first question.
I think that the beauty of this system is that even if there is underreporting of cases, you will still be able to see information coming from long range. I'm going to go back to this picture, okay? This is actually quite important, because this is an important detail about how this system works, which is very different from other systems, and it makes it more robust against underreporting of cases. See, if I'm playing this is what's causing me to want to become more careful, because I see the cases coming towards me. But now, if you imagine that you have underreporting of cases, if the truth is double of this, and you only see half of this, you still would be scared. The only time that you will get in trouble is if one of the ones turns into a zero. Then you cannot see. But my point is, we have designed this graph, this chart, so that it stops at 5. It is intentionally designed to stop at 5 so that even one case is scary. In reality, If you were looking at this chart in a city, out here wouldn't be 5 plus, it would be like 50. And the next one might be something like 35. But we kept them all at 5 plus, just because if it was that high, people will say, well, if it's 50 over there, why should I care that it's just 1 nearby me, right? But once you cap it at 5 plus, it has the nice property that even if half the cases are lost, if you imagine, you just see bars and you only see half the height of the bar, and the only time you're in trouble and lose data is when the 1 becomes the 0, because you're looking for the cloud moving towards you. So in that sense, what this is exactly how you solve the problem of underreporting of cases. Actually, underreporting of cases provides false sense of security, period. It's already providing false sense of security right now. Whether there is this app or no this app, false sense of security when there's underreporting of cases. What this does is it tells you, oh, actually, those cases are getting pretty close to me. In fact, this will make you more worried than less. So it's the other way around.
Thank you. Yeah, and I agree with you that, and also people attitude that, like you said, that makes disease even more dangerous. And I also believe that if humanity have the power to foresee the future, that would give at least a degree of fear, live in fear, right? So right now is the question whether like, how do we make them more like understand this to make the informed choices rather than just make them paranoia, right? So the second question, how far is the maximum distance that can be called nearby? Because you say it's not about kilometer, right? But it's the nearby and often notions. So Professor Paul.
Yes, that is something which is very important, and it's also we can calibrate it. We can change it over time based on what is relevant for the disease. So let me be very careful and explain what each of these links means. Now, I will tell you what it takes for 2 people to be connected together in this network. And then we can tell you a person is 12 degrees of connection away on this network. Each degree of connection is one of these links on the network. Okay, now what's one link? One link on this network means in the past 2 weeks, there were at least 2 different days. And on each of those days, the 2 people... I'm sorry?
It's okay. Please continue, Professor.
Oh, no problem, no problem. So again, let me write it down carefully in words because this is a detail that I want to have not missed, okay? So what does it take to be connected? In order to connect 2 people, what it means is that over the last 2 weeks, there are at least 2 different days where the 2 people were within 5 meters for at least 15 minutes. Okay, now let me talk a little bit about what this is. There's a reason why these numbers were picked, and they're also adjustable. Okay, so this is designed so that this is the first important thing, 2 different days. Why 2 different days? Because we are trying to predict the future. The concept of this app is based on what we have detected in the past, what is a likely future interaction for you? And that's why we want multiple days. Now, that's why there are 2 weeks, because the 2 weeks are because sometimes you have interactions that are only on weekend, only on Saturday, or only on Sunday. And since I want it to happen twice, I need to make sure I have 2 weeks of it. That's why that is a 2. Actually, I'm trying to show that the key number here is this 2 that I've circled. That 2 drives the next 2. Then the other thing here about 5 meters, 15 minutes, that one we can always change that. But what we found out is if you change the 5 meters to 6 meters, 5 meters to 10 meters, no big difference. And if you change the 15 minutes to 20 minutes or change it into 10 minutes, no big difference in terms of which two people are connected. Just think about your own life. In your own life, if you were supposed to list if you were supposed to list who were the people over the last 2 weeks, for which there were at least 2 days that you were this close to them, it's probably just who you live with, who you work with in the same office, who you have lunch with frequently. That's our network. So the important thing is that we are capturing who is frequently around who. And that is a very short distance, 5 meters. However, we then use that to become a very long distance like this. Because each one of these links means that maybe this, let me move to a screen where I can see clearly. What this means is maybe you're here. We're telling that you maybe work with this person in the same office. This person lives in the same house as that person, which could be very far from your house. And then this person works in the same business place as that person. Now this sick person could be 10 kilometers away from you. The thing I want to emphasize is the distance between you and the sick person could be the entire city. However, the reason it's important to you is because that sick person works with someone who lives with someone who works with you. And suddenly, that's why this is so much more powerful than measuring the distance between disease in kilometers. If you only measure distance between disease in kilometers, you will never pick up this 10 kilometers away person. However, in a modern world where people move around, you want to know who is frequently around who is often around who. So the answer is the range is actually extremely long. However, each of those connections is a very important one that you should be careful about.
Thank you, Professor Po. For the next questions, can you please elaborate on how vaccine hesitancy can be addressed through NOVID if it's got a potential to this?
Yes.
And can this app be made available in local languages as well?
Okay, yes. So I forgot to answer the local languages, so let me mention that one first. Of course it can. We already have it working in Spanish, in Russian, in Chinese. For us to be working in Thai language, we just need to talk to you and have somebody to work with to translate. We have an online system that lets us translate each individual word. And we just would need to work with you. The whole thing can be in Thai language, no problem. Now, the question about vaccine hesitancy, to me, vaccine hesitancy is a very complicated subject, but I see two parts of it that we can help. One part that we can help is helping people to know that it is safe. And by them being able to see more people around them who have gotten vaccinated, then they can say, it actually looks like people got vaccinated and nothing bad happened to them. Hundreds of people have gotten vaccinated around me, seems okay. Basically, with vaccine hesitancy, one angle, this is a complicated subject, but one thing we can help with is that people don't want to be first. Some people want to say, I want to see what happens to the other people. And if they're okay, then I get vaccinated. Those ones wait. Now, there are some people who will go anyway and just get it because they want to be careful. As those people go first, our app lets everyone else know that there are people around them who got vaccinated. Oh, I should have made clear. The way that our app works is that we tell you every time someone got vaccinated, that shows up on a chart that shows you how far away in your network is that person who got vaccinated. So it's just like how our app will tell you this wave of sicknesses. We also tell you the wave of vaccinations. So you can see that there are vaccinations happening all around you. Then you know it's safer. But the second thing that we could help with is that one thing that makes people finally go get vaccinated is when they see there's a danger. If they don't think that the disease is coming and it's not a big problem, then they will not be as inclined to get vaccinated. But if they see that suddenly this radar is showing, Omicron variant, wow, the whole thing is lighting up red and moving closer and closer. Maybe some people will say, then maybe I want to get vaccinated after all. Not perfect, nothing is perfect, but these are new tools that can be used to help.
Thank you. And I think this is going to be my last question now. So, because it's got a very good potential and a high chance of success in a smaller scale as made by our discussant. My question is something to do with the interoperability here. So let's say if incoming travelers come to Thailand and then they happen to have this app, would this be able to link with the local context in a way? Because they're not related to perhaps any of us. So how is they going to be counted as the third or second degree of relativity? Professor
Yes. So, well, one thing is that if we were working together, we would be working on the same platform that anyone in the world can download and use. So this is our own platform, which is interoperable with anyone else who's using this NOVID app. And by the way, our hope is that the whole world eventually will realize that this is the right approach. However, there are other things you can do also. I want to emphasize that even if you have people coming in who are not using the app yet, if the people who are already there have the app, then if the disease jumps from a new person who just arrived to a local person, at least the app can help slow the spread through the local population. The point is, the point is, it is interoperable. However, I don't want to oversell that because it's not that everyone in the world is using it right now. Right? Of course, that might be someday. And if we work both with you and if we end up working with Singapore and if we work with different people, well, of course, it's great. Then all of us are using the same thing. However, I want to emphasize that even before that, it's useful because as long as the local people have it, then the disease is harder to spread through the local population.
Okay. Thank you. That's nicely said. I'm being mindful of the time now. We almost come to an end of our webinar. So I just want to summarize some key points that we have discussed during our webinar here. So NOVID application can perhaps give the decision-making power to people. And it's also a step up sort of from existing contact tracing app that exists in the country. And it has the application to address like vaccine hesitancy and also help facilitate study of real-world vaccine effectiveness as well. But like you said, nothing is perfect. It is still in a new and needs to be trial and tested. And perhaps Thailand could be one as well. Thank you very much, Professor Po, for joining us today and giving us so interesting lectures and memories too. And we are coming close to the end of the year. I also want to wish all of us here a Merry Christmas and also a very, very Happy New Year. Thank you very much. But Professor Po, before we go, do you want to have a last word before we finish off?
Yes, I will just say that I have also been very impressed by all of the people that I have met from Thailand in the past, which is why it is very great pleasure for me to talk to you. I have worked with some of your most talented mathematical students, so I know that there are very, very intelligent people. And at the same time, I have also been very impressed by how friendly people are. And that's why I think there's a hope for something like this to be useful in Thailand. And if you end up being interested in working together, oh, I would love to.
Thank you very much, and then we will stay in touch. And yeah, in the meantime, please everybody stay safe and healthy. Thank you. Goodbye. Bye for now.